Hello everyone, my name is Tan Lim Guan and my teammate Gan Sing Lee are from Dr. Mini class. We conducted our CSR project in the kindergarten. On 3rd December, we paid our visit to Tadika Borong Hantu, an early years education for children aged 2 to 6 years old, with 13 teachers working on shift. Data collection was collected by walkthrough observation and verbal interview.
Overall, the kindergarten has taken safety measures for everyone, include teachers, workers and kids, whether in the classroom, washroom or even office. The Malaysian government places a strong emphasis on childcare and has formulated Childcare Centres Amendment Act 2007 for kindergarten to comply. Under this policy, Tadika Borong Hantu has installed CCTV to monitor the safety of everyone and make sure the teachers and staff feel safe. Starting July 1, 2020, kindergartens in Malaysia are allowed to operate after intermittent lockdown and are subject to strict compliance of standard operating procedures. Every teacher was wearing masks and vaccinated, and kids were wearing masks too for most of the time to avoid the spread of virus. My teammate and I also required to check the temperature and register before being allowed in. Furthermore, we also observed that there are 1 meter social distancing stickers on the floor, first aid kits and fire extinguishers at prominent locations, emergency contact number and safety measure SOP on information board.
However, there are some rooms for improvement we think will be beneficial to the teachers after our survey. First off, we noticed there are few hazards in the washroom. The light source was dim and had slight bad odors. Kids at a young age can cause problems in the toilet. They don't know how to use the toilet properly and splash water around the toilet. Shoes were provided in the area to avoid slippery. We suggested more measures taken, such as having an exhaust fan to remove moisture out of the washroom and adding a light source. Then there is a risk of hitting the shelf when washing your hands because it is placed too low with chemicals on it. We understand it is to keep out of reach of the children, but can be placed in a cupboard for the safer reason.
According to the verbal communication with the person in charge, states that teachers can develop some physical, mental and emotional stress. Paperwork will stack up, kids sometimes will act out and lessons will need to be planned. It can lead to teachers becoming disengaged, dissatisfied and burnt out. Kids are wild, they can bite and scratch unintentionally because they are afraid of playful. Therefore, first aid kits are prepared in the plain sight.
Besides, in the kitchen, we noticed the misplacement of heavy stuff. They should be put on the lower parts of the shelf to prevent injuries. Kid toys are scattered around all over the floor. There are risks of stepping on them while carrying stuff. Also, the air conditioner machine is found placed above the cooking stove. We think it could cause damage to the machine and hence affect the air circulation indoors.
Classroom-wise, we notice a few hazards too. Firstly, the edges of some of the shelves are sharp and dangerous, but credit is still given where most of the tables and shelves found in the kindergarten are rounded. Our suggestion is to cover all sharp edges with corner guards. Secondly, in terms of ergonomic concept and guidelines on occupational safety and health in office, seating shall have leg room to ensure workers' legs can move freely. However, the room has been misused by placing stuff and the seating form is not correct for the admin. Hence, the things under the table shall be removed and replace the chairs with adjustable one for correct sitting posture. Ergonomics in the workplace is important in providing an appropriate and comfortable working area, especially for teachers who always have to bend their bodies and lift the children off the ground to entertain them. There are two solutions that we would like to propose. Is first, to provide different seating options for adults by lowering or raising the furniture. And second, place floor cushions for comfortable sittings.
In conclusion, the kindergarten has done good efforts in keeping workers safe during work. However, there are some minor risks detected and every single risk would need to be monitored and taken care of.